Good morning and welcome back to Open Med School. Today we are going to discuss 10 rules of normal ECG. These were developed by Professor Douglas Chamberlain. He was the British cardiologist who introduced training of paramedics in ECG. These simple rules are used to identify whether an ECG is normal or abnormal. This does not identify what is the abnormality. That is a point to be remembered. This can be used by anybody who has got interest in electrocardiogram. Minor modification has been made in the rule so that you can easily apply this in everyday practice. I have started the rules first with the P wave, then with the PR interval, then the Qrs complex, then about the Q wave, progression of the R wave, the ST segment, the relation of the T wave with the Qrs complex, and the appearance of the waves in AVR. That is how I have made the modification. Let us go one by one. The rule number 1, the P must be upright in lead 1, lead 2, V2 to V6. So you can see that the P wave is upright in all these leads, and it must be negative in AVR, and the duration of the P is important. It should not be more than 3 small divisions, and the height is less than 3 divisions. Easy to remember. So you should look at the shape of the P wave, whether it is upright in lead 1, 2 and V2 to V6, and also see what is the height and breadth of the P wave. Next is looking at the PR interval. In a normal ECG, the QRS should be preceded by a P wave in the normal PR interval. The normal PR interval is between 0.12 to 0.2 seconds. That is 3 to 5 small divisions. So you should look at the PR interval. First see whether the QRS is preceded by a P in all the leads. It is present, and the duration should be less than 3 to 5 divisions. If the QRS is not preceded by a P wave in the normal interval, some type of heart block is present. Next we look at the Qrs complex. The normal QRS is narrow. What is meant by a narrow Qrs complex? The duration must be less than 2.5 small divisions. So if it is more than 3 divisions, it is a broad complex. Next rule is related to the direction of the QRS. The QRS must be upright in the limb leads. Lead 1 and lead 2, it must be upright, and lead 2 is taller than lead 1. Third is next you should look at the Qrs complex. In the Qrs complex, look at the Q waves. There should not be any pathological Q wave. What is by pathological Q waves? A Q wave which is more than 0.04 second, that is 1 division breadth, or 25% of the height of the R wave, it is abnormal. So there should not be a Q wave in lead 1, 2, V2 to V6. The same leads where you are looking for the P wave and QRS complex. There should not be any pathological Q. Next you will be looking at the progression of the R wave. Normally the R wave will progress from V1 to V4, that is comparatively a small r. By the time it reaches the V4, it becomes dominantly positive. This is called a normal progression of the R wave. At the same time, the S wave will also increase from V1 to V3. So this is a must to be looked for. If it is not present, that means that ECG is abnormal. The transitional zone, that is a zone where predominantly negative QRS becomes positive, is somewhere in the V3 and V4. Next we look at the ST segment. The ST segment must be isoelectric, that is, it should not be elevated or it should not be depressed. Except in V1 and V2, there may be mild ST elevation can be there. Once you have examined the ST segment, now you look at the T wave. T should be upright in V1, V2, lead 1, lead 2, V2 to V6. The same leads where the P wave is upright, the T is also upright. Next rule goes in parallel with the previous one, that is, the QRS and ST segment are in the same direction. They are concordant. The QRS complex is predominantly upright, the T will also be upright. Now we go to the last rule, the 10th rule. All the waves must be negative in AVR. As we know, the AVR is a cavity lead. You are recording, the exploring electrode is on the right shoulder and looking into the cavity of the heart. All the electrical force are going away from the AVR, the exploring lead. So it must be negative. So in the AVR, look at the AVR. The P is negative, the QRS is negative, T wave is negative. So this summarizes the 10 rules. You can easily remember and you can easily follow if you analyze from P wave next to the PR interval, then thinking about the QRS, the direction of the QRS, presence or absence of the pathological Q, progression of the R wave, the ST segment, then the T wave, and the direction of the T with the QRS, and finally AVR, all the waves must be negative. Next time when you come across a patient's electrocardiogram, you systematically analyze and see whether the ECG is normal or abnormal. Hope you have enjoyed this video. Thank you.